What is Medicare for All? Medicare for All is a popular proposal to expand healthcare access. Originally, Senator Bernie Sanders proposed a Medicare for All bill in 2017. Sanders' bill would replace all other insurance with limited exceptions such as cosmetic surgery. Private insurance, employer-provided insurance, Medicaid, and our current version of Medicare would all be replaced by Medicare for All. The Affordable Care Act, commonly referred to as Obamacare, would also be replaced by Medicare for All. Currently, Medicare is for Americans 65 and older. They receive care, but they're also responsible for some of the cost. However, Medicare for All would be a single national health insurance program that would cover everyone living in the U.S. It would pay for every medical service, including dental and vision care, mental health care, and prescription drugs, with no copays or deductibles. Medicare for All is effectively single-payer health care. Single-payer health care is where the government pays for people's health care. The new name, Medicare for All, just makes the concept more popular. How much would Medicare for All cost? The estimated cost of Medicare for All would be in the range of $25 trillion to $32 trillion over 10 years, and in order to pay for the program, it would redirect current government spending of $2 trillion per year, raise taxes on incomes over $250,000, and utilize a wealth tax on the top 0.1% of households. Let's go over some of the pros of Medicare for All. Universal health care lowers health care costs for the economy overall, since the government controls the price of medication and medical services through regulation and negotiation. It would also eliminate the administrative cost of working with multiple private health insurers. Doctors would only have to deal with one government agency, rather than multiple private insurance companies along with Medicare and Medicaid. Also, companies would not have to hire staff to deal with many different health insurance companies' rules. Instead, billing procedures and coverage rules would be standardized. Additional pros include equalizing the medical experience for everyone. Hospitals and doctors would be forced to provide the same standard of service at a low cost, instead of targeting wealthy clients and offering expensive services so that they can get a higher profit. Universal health care leads to a healthier population. Studies show that preventative care lowers expensive emergency room usage. Lastly, if you make less than $250,000, Sanders' additional tax will not affect you. Let's talk about some of the cons of Medicare for All. Some analysts are concerned that the government may not be able to use its bargaining power to drive down costs as steeply and as quickly as Sanders predicts. Some argue that Sanders is overly optimistic on this aspect of the bill. Other analysts are concerned that making healthcare completely free will drive up the usage of medical services. Some have pointed out that no other developed nation has zero out-of-pocket costs. Also, people may not be as careful with their health if they do not have a financial incentive to do so. Other concerns include the government limiting healthcare spending to keep costs down. Doctors might have less incentive to provide quality care if they aren't well paid. They also have less funding for medicines and new life-saving technologies, and they might also spend less time per patient in order to keep costs down. Lastly, other universal healthcare systems report long wait times for the ER or elective procedures. The government may also limit services or drugs with low probability of success or for rare diseases. Today, Medicare for All is becoming an increasingly popular bill in the upcoming elections, and presidential candidates and lawmakers are continually presenting other variations to the healthcare issue in America. Did you find this video helpful? Please subscribe to my channel, Illustrate to Educate, by clicking on the button above, or check out some of my other videos. And thanks for watching.